All right. So I have the pleasure of introducing our next speaker, Dr. Nirav Pandya. Dr. Pandya is an orthopedic surgeon who specializes in sports medicine for young athletes. He uses a variety of traditional and minimally invasive surgical techniques, providing care in both clinic and hospital settings. He has a particular interest in arthroscopic treatment for cartilage and ligament injuries of the ankle, knee, elbow, and shoulder. He serves as vice chair and previous division chief of pediatric orthopedic surgery and the director for the Center for Sports Medicine for Young Athletes. Nirav's research interests include how single sport specialization affects young athletes, developing techniques for treating cartilage and ligament injuries in growing athletes, and techniques for improving the outcomes of cartilage and ligament surgeries for the same group. He also studies outcomes of traumatic injuries in pediatric patients. He earned his medical degree at the University of Chicago and completed residency in orthopedic surgery at the University of Pennsylvania. He then completed a fellowship in pediatric orthopedic surgery at Rady Children's Hospital in San Diego. As an undergraduate at the University of Chicago, Dr. Pandya was on the track and field team, serving as captain during his senior year. He remains one of the top 10 triple jumpers in school's history. While in medical school, he served as the assistant coach for the school's track and field team, coaching several national qualifiers in the long jump and triple jump. Not me. You can often see him using these skills while hurdling over beds in the hall during his rounds in the hospital or dunking on Dr. Brian Feely in the basketball court, although he still can't jump as far as Dr. Watkins. In his free time, he enjoys spending time with his wife and 2 kids and exploring the outdoors in the Bay Area. He also co-hosts the podcast 6 to 8 Weeks, Perspectives on Sports Medicine, with fellow UCSF faculty members, Dr. Brian Feely and Dr. Lansdowne. You can also find him on 95.7 The Game, or Cron 4, or pretty much anywhere where you can find sports these days, talking about injuries. And fun fact, as we're doing with everyone, Dr. Pandya is a DJ in his spare time and has been for a long time, and even opened for Eminem and Busta Rhymes. So there you go. That's a pretty cool fact, right? So please join me in welcoming my good friend, Dr. Nirav Pandya.
Thanks, everyone. I realized I DJ'd the holiday party last night, and I'm giving one of the early talks, so excuse me if I'm a little tired. But so thanks, everyone, for coming. I'll be talking about youth sports. It's a passion of mine. It's a large part of my clinical practice, and I think a lot of what we're dealing with youth sports is not necessarily the surgical techniques and, all the things that we can do in young kids, but really how can we prevent these injuries from occurring? And a lot of this has to do with the culture that we're dealing with and kind of what we see in kids these days. So I have no disclosures. Really the goals of this talk will be kind of, number one, first understand the current youth sports epidemiology, because I think as we all take care of kids, one of the things it's important to understand is how kids are actually playing sports. What's the data out there? And then secondarily, recognize the risks of playing sports in this way, particularly with sports specialization, which is the big, risk factor for why kids are getting injured the way that we're seeing, and why, fields like mine, youth sports in pediatric orthopedic surgery and pediatric sports actually exists. I think it's important then to be able to translate that knowledge into understanding how you can counsel parents about the implications of playing a single sport. And then, I think the last part of it, really understanding the disparities, because I don't think that gets talked a lot about. Is that the culture that we've built up is leaving a lot of kids outside of being able to actually play sports. And we talk about injuries, we talk about crazy parents, we don't talk about all the kids who are excluded because of the way sports are set up right now. So if you look on, you type in youth sports on the internet, if you looked at 15, 20 years ago, it was maybe you'd find something about rec sports, you'd find something maybe about some club. But if you type it in now, it's really about the professionalization of youth sports. And things have really changed, particularly over the past 5 years, where sports have become a professional enterprise for individuals, for adults. They're making money off of kids because how they've basically given this dream to parents and kids that they can turn professional, they can make all this money, and it's really changed the way that kids are playing sports. Now parents and their peer group are interacting. So if you look at where kids are playing sports, there are about 5.5 million children who are playing sports in school, but there are almost 30 million children who are playing sports out of school. And this is continuing to change more and more, where more and more school-based programming is decreasing, recreational programs decreasing, and kids are getting their sports experience not in a school setting, but rather in a club or private setting with questionable coaching, as well as kind of interest in terms of what's best for these kids in terms of their long-term athletic development. And when we talk about the lack of school-based programming, one of the things that is tremendously dropped is the amount of daily physical education class. How many of you had PE in class every day when you were growing up? Right. So now my kids who are in high school, they have PE once a week. Okay. And that once a week is really just kind of like, let's watch a video, let's talk about how to dribble a basketball, but they're not getting that daily PE class where even though all of us probably have some bad memories of PE class, having change and things like that, we actually did learn a lot about different sports. You learned about core strength, you learned about flexibility, you learned about all these things that were essential to developing yourself as a well-rounded athlete, which is the one area where kids, even if they weren't playing sports, outside of school, would be able to learn those things, and that's dropping. So that basic education about physical activity, just doesn't exist anymore. And instead, it's been turned over to these coaches and private clubs. So the problem really is we have one group of kids who are hyper-specialized. They're playing one sport year-round and are at risk for all these injuries that we'll talk about. But then there's another group of kids who don't have PE class. They don't have money to be able to afford, the sports. There aren't rec programs, and they're excluded from sports. And these are the kids who also have those problems such as diabetes and hypertension, all those things that we don't talk about. So even though we're going to concentrate a lot on that group in the upper left there, we have to think about that other group of kids who just don't have physical activity because of the way sports are basically packaged for kids these days. A great website is the Stop Sports Injury website. It has great information for parents if you guys are looking for a great place to basically refer parents to in terms of basic education about youth sports injuries. But one of the great statistics they have on there is that 50% of all youth athletes will suffer at least one significant injury a year. Now, this is a injury that requires you to go to an orthopedic surgeon, go to the emergency room, go beyond just, kind of resting and icing, et cetera, which is a significant amount. When I was growing up, playing sports, I can remember maybe like one or two kids who maybe had a cast, maybe hurt their knee, had a knee mobilizer on for way too long. But they were, not many kids were getting injuries. But now, if you look around, I have kids come into my clinic who are 10, 11, or 12 who tore their ACL, and they already know the protocol. They have 3 friends who already tore their ACL. Which is kind of crazy, right? And so their ability to understand what's going on is reflective of the fact that a lot of their friends are getting injured. They know about return to play protocols. They know about surgical techniques because their friends are experiencing it. Their parents are taking them to these visits, which is a huge shift from what we look at from 15, 20 years ago. So really what's different now, I grew up in Chicago, and back then, the greatest athlete, and I still think the greatest basketball player, even though I'm from the Bay Area now and Steph Curry's getting close, suddenly in the middle of his career decides to go play baseball, right? And people can question how good he was, but, he went ahead and played baseball. And no one really thought much about it. They're like, oh, Michael Jordan played baseball too, right? It makes sense. Why wouldn't he go play baseball? Like the fact of could you imagine LeBron James right now deciding in the middle, go play football or someone else? It's this crazy concept, right? That people would do something else. So what's really changed in culture now? Why is this happening now? And I think a lot of it has to do with how we're actually getting presented sports, right? So in the past, it was you played sports, maybe you talked to your friends, you talked to your neighbors, but now sports culture is all over the internet, right? So we all have, even though we're not teenagers, we all have social media, we all see the videos, and everyone gets this impression of wow, this kid down the street, he's playing at all these tournaments, he's doing great, here's his recruiting video, my kid needs to get in that because that's what they need to do. Or this club has this fancy advertisement that says, if you come in at age 6 and practice with us for 40 hours a week, your kid's going to get a college scholarship. So a lot of this this environment of youth sports is being created by social media. And as a result, this goes into peer pressure, it goes into family pressure. Everyone's talking about it. It becomes your social network. So that has changed a lot, is that what we're consuming is basically influencing what we're doing in terms of how our kids are playing sports. And I think a lot of this also has to do with the cost of college. College is increasing tremendously. So the average cost of a 4-year private university is $234,000. That's a lot of money. So as a parent, you're thinking about, well, how's my kid going to potentially be able to pay for college? So one of the things that comes up is that maybe they can get a scholarship, right? And then there's this new thing that's kind of come in with a name engine like this. How many of you guys know what NIL money is? Okay, right. So for those who don't know, NCAA athletes can now get paid at the collegiate level, and a lot of the big schools, particularly in football and basketball, they have these booster groups that basically have this money. And these athletes are getting paid by universities, and it's basically become professionalization of college sports. But what's happened when you look at the youth sports levels, now you see 9, 10, 11, and 12-year-olds who feel that they can get money for college sports. So this pressure to specialize is dropped even earlier, right? So before it was maybe I'll specialize so that I can become a professional athlete. And we'll talk about the statistics, but now it's dropping down to I'm not really thinking about becoming a professional athlete. Maybe I can get $6,000, $7,000, $8,000 a year, or even get $1 million, right? Through college, through NIL money. And you see these statistics, and a lot of these clubs will have it out here and say, look, if I go to Texas A&M, you can get $85,000 a year. You go to Notre Dame, you get $34,000 a year, and you see all these, these quarterbacks, these basketball players, et cetera, getting tons and tons of money. So as a result, these parents are like, look, college is really expensive. Let me see if I can get NIL money for my kid, and we'll talk about the percentages as well too. Now, basically, you see these statistics. So what do parents think? How do I get my kid to be a phenomenal athlete? Now, for the most part, a lot of these kids who are going to go on to that level are naturally gifted. They've avoided injury, but a lot of parents feel that, look, if I do one thing repetitively, then I'm going to get better at it, right? Which seems to make sense for a lot of these parents because they look at this 10,000-hour rule that was promoted by Erickson that said that in order to achieve expertise as a musician, not as an athlete, but as a musician, you should practice something 10,000 hours and you'll become phenomenal at it. So this is what these clubs promote, is that if you do one thing again and again and again, you're going to become better at it, and then you'll become an expert. And as a result, what's happened is that we have single sport specialization, which the actual definition is intensive year-round training in a single sport at the exclusion of other sports. And I think this is also nuanced as well, too, is that I do see a lot of kids who come in who are not only, who may be like, look, I'm not specializing, I'm playing multiple sports, but then they're doing multiple sports 30 hours a week, okay? So there's a dual part of this. It's not just specializing in one sport, but you also have to look at volume as well, too. So a lot of kids, it may be okay if they're playing one sport, but they're doing it for 8 hours a week. The other problem may be they're playing multiple sports and doing it 30 hours a week. So it's both the specialization and the volume. So it's a balance of both those. And we just don't encourage free play. How many of you see a group of 10 kids who are just playing in the park, playing a pickup game? Have you seen that in the past year? Right. Do you guys even know where the basketball court in your neighborhood is? Is there even a basketball court, right? Because free play is not encouraged anymore. The fact that you could go, I imagine, go find some 12-year-old on the street and say, hey, when was the last time you played pickup basketball? No one, they don't play pickup basketball anymore because what's the purpose, right? I've had kids come in and say, why would I play pickup basketball? I'm not playing for a club. No one's going to watch me. It's not fun. I could get injured, et cetera. But kids aren't out there in the street just playing sports just for fun. And that's a lot of the issue, is that sports have become basically a means to an end as opposed to an event in and of itself where kids are just having fun and getting out and playing. So what we're basically seeing now, that these kids are specializing in sports and positions at an earlier age. We're getting this large group of particularly younger kids who are getting these really severe injuries. And a lot of this has to do with the fact that we're having kids do something repetitively when their bones are mature. They're not resting after injury. They don't necessarily have the coaching in terms of training, conditioning, nutrition. And all these things are setting them up for at age 9, 10, or 11 to get these serious injuries, which will then impact them both from a structural standpoint later in their life, as well as in terms of them staying in sports, which is the important thing for me, is that we want people to have a lifelong level of activity as opposed to dropping out when they're age 13 or 14. So one of the things that I think is a great indicator of this is ACL injuries. It's one of the things that we see a lot of, but I think is a great reflection of where we're seeing youth sports. So if you look at 15, 20 years ago, the number of people under 14 who had an ACL tear was pretty low. But now you look at these sports and you look to see the annual incidence of ACL tears, and it's increasing year by year by year, and the age is going lower and lower and lower, and particularly for women's sports. And I think we need to take a step back and say, look, in our field, we can fix these things, we can take care of them, but should they even be getting them done in the first place, right? Should I be doing an ACL on a 10-year-old? Should I be doing a revision on a 13, 14-year-old? And I think we need to take a step back and understand that for the vast majority of kids, we'll go over the statistics, their chance of them playing professionally is really, really small, right? But the chance of them tearing their ACL, getting a meniscus tear, dropping out, or having a severe injury that's going to lead to arthritis down the road is extremely high if they continue to play the way that they're doing. So if you kind of reflective of this, there was a great documentary by ESPN several years ago that talked about how playground basketball is dying, like no one plays playground basketball anymore. And a lot of these kids now are going to these tournaments, and everyone seems to go to Vegas all the time. It's like these 9-year-olds, I'm going to Vegas to play basketball. It's like great. But I had this kid come in several years ago in clinic, and I asked him, like, why don't you just go play out, play, as you're kind of returning from your injury, why don't you just go to the playground and play with some kids? And he told me that playing pickup isn't good for my brand, okay? So you can see, like, what kids are thinking, right? Like, kids are basically seeing their sports as a commodity that they can utilize to get money, but this 14-year-old is not very good. They're basically saying, like, why would I go out and just play, right? It doesn't, and that's kind of this mindset that's going into these kids from younger and younger ages. And this was a great story that was done by Baxter Holmes, where he was talking about youth basketball. and kind of like the culture and what AAU basketball has done. So it's if you have not read it, it's from 6-7 years ago. It's a really good story that talks about this culture, what it's doing to kids, how money is involved with it, et cetera, and then all the injuries are seen as a result of it. So really captures this, kind of the culture in basketball. And basketball and soccer are the two big ones that we see a lot of the specialization occurring. So for me, the clinical part of this is very easy, right? You tear your ACL, we know how to fix it. But the harder part is the non-clinical part. And that's where I think where a lot of the counseling and work needs to be done. It's the social part, it's the emotional part, it's the coach, the parent, the sibling. That's the really difficult part. And I think with professional athletes, it's really easy, right? So Klay Thompson tore his ACL and his Achilles, and everyone's like, when's he coming back? When's he coming back? When's he coming back? But 2.5 years later, they treat him with extreme caution. No one's questioning like, okay, let's just make sure he's really, really good before he come back and play for the Warriors. But then you get this 13-year-old in, right, who's playing basketball, and him not playing, there's no consequences, right? He's treated with no caution. They want to clear him at 6 months post his ACL. Can you give them a pain shot? Like all these things that we're doing with youth athletes who don't have millions of dollars attached to them, and all these parents and coaches want them cleared immediately, right? And a professional athlete whose career or livelihood, millions of dollars for the team, for the athlete, for marketing, everyone's super cautious with them, right? So where did that disconnect happen, right? So why does that 12-year-old have to get cleared with a torn ACL when someone who has an injury is waiting longer and longer and longer? And that's kind of the environment that we're dealing with. So a lot of this has to do with the data that the parents don't hear. And I think this is really key for a lot of parents is that I can tell them like, look, specialization's bad. It's going to lead to injuries, et cetera. But then you need to actually tell them what the data is in terms of their chance for athletic success, okay? So if you look at the percentage of people who actually are high school athletes who go on to play professionally, it's 0.006%, okay? Now you tell the statistic to parents and they don't believe you because they know some neighbor, and it's probably the same neighbor in all of the Bay Area who went to play professionally, okay? They're like, oh, I know this guy who played professionally. But it's really small, right? But the clubs, right? They have that same image of the one player who made it professionally, and then everyone thinks they can be that kid, right? Even though they have thousands of people going through that club, okay? So that's the first statistic. So then the parents are like, okay, fine, my kid's not gonna play professionally, okay? Then they're gonna say, well, my kid's gonna get a scholarship, right? He's gonna get a scholarship because everyone gets scholarships, but only 2% of high school athletes will actually get an athletic scholarship, okay? So that, once again, that like start knocking down the parents like, wait a second, I thought everyone gets a scholarship. And then this is the one that I think is really important, is that the average 4-year college athletic scholarship is $14,000 over 4 years, okay? Now, if you have kids and you play youth sports, you can imagine $14,000 is pretty much gone in a couple of years, okay, from youth sports, right? So you're basically doing all this running around, having your kids have this risk for injury for the 2% chance to get something that you've already paid well over, right? And your kids are going to drop out. But parents don't hear that. They don't know that number. So I think it's really important to steer the statistics with them because that may help to start shifting like what they're doing in terms of their kids and what they're doing in terms of sports. And then how many of you know how many full, there's 6 sports that give full scholarships. What do you think are some of the sports that give full scholarships? Right. Okay. What's not on here? Soccer, right? And baseball. Okay, right. What are the 2 big travel sports? Soccer and baseball, right? The number of parents who come in who don't know you can't get a full scholarship in soccer and baseball is crazy, right? So they're like, oh, I'm gonna get a full ride. Like, no, you're not. It doesn't exist, right? So I think that's one of the things that parents need to know is that they don't talk about it. No one's gonna say on the club site, like, come join our club so you won't get a full scholarship, right? So I think these are all the statistics that parents need to know so they can be informed in terms of the decisions they're making. Because a lot of these parents, by the time their kids are 18, and they, first of all, their kid may not make it, and then they realize, wait, I spent all this money and all this time and all these things, and I was kind of chasing this dream that doesn't exist, okay? So I think it's important to let them know that. And this is just it was off the NCAA website that talks about the percentage of, people who go on, from playing high school, go on to play sports. I always joke, your biggest chance you have is to play men's ice hockey. There's like a 14% chance if you play hockey in high school, you'll go on to play 11% chance to go on and play NCAA, but you can see the statistics there. It's actually pretty small for most kids in terms of just going on even to play. And then, we talk about NIL. So, this is a Shadur Sanders, who plays for the Browns right now. If you look at the kind of the second line right over there, people ask, well, I'm going to get tons of NIL money. Over half of NIL deals are valued at $100 or less, okay? That means they put your picture up, you get $100 and then put your picture up, okay? And then the average, is usually around $2,000. So once again, even the NIL money, and that's primarily in football and basketball, right? So it's a lot of sports that are, that are the major money-making sports. This fact of a lot of clubs are saying, look, your kid can get an NIL deal. It's actually, the money is really, really low, okay? So once again, it's opening the eyes to parents to what they're chasing and what the data actually is, okay? And then what we do know, which is actually a pretty guaranteed statistic, is that with this current sports culture, 70% of kids are going to drop out by age 13, okay? So that's 7th or 8th grade. That's pretty crazy, right? That's when most of us were actually probably getting, serious with sports. We're taking things, taking things more, seriously in terms of high school, deciding what sports we're going to play. And now having a 15-year-old, I've seen the number of kids or his teammates who by age 12, 13 are like, I'm done with soccer, I'm done with baseball, I'm burnt out because they've been playing by age 6. It's crazy, right? High school is when you start taking sports seriously. And so that's what we're doing, is that beyond the injuries, beyond the money, is that if you're dropping out of sports by age 13, what does that mean for your cardiovascular health? What does that mean for your mental health? What does that mean in terms of how you're going to be active as an adult? And I think that's where the most kind of pressing matter is that, we're going to see the kids who kind of grew up in the sports culture over the past decade, and then we're going to see them 30, 40 years. What does it mean for them as adults, right? And what are we doing as a society? So I think that's important, is that we need to not only keep kids in sports so that they're healthy and active, but the mental health, but also what does it mean for them in terms of adults, in terms of arthritis, et cetera, and injury risk. And the top 3 reason that these kids will cite when you survey them is us, right? It's adults, coaches, and parents, right? So it's interesting when I see these kids come in that I've taken care of for a period of time and they're 14 or 15, and I say, why'd you drop out? Well, they say, I'm not having fun, it hurts to play sports, and I didn't enjoy it anymore. So for a lot of them is that we as adults need to be able to control this culture so that the kids can have a good experience, right? So for most people, sports growing up was something they look back on because it was fun. They had their friends there, they learned some stuff about resilience and hard work, et cetera. Very few of us were looking at sports in terms of like, well, I really liked it because I was getting good at it, and I played in college, maybe went professionally. It's about the environment we're creating, and unfortunately, it's not working very well currently how it is. So we know based on the data that specialization increases burnout, it increases injury, it increases social isolation, it leads to poor adult health, it does not lead to a scholarship, okay? But then I do still get a subset of parents who come in and say, look, that's all great, but I still really want my kid to do this because I want them to become professional. I want them to be elite. That's all that great data, but my kid's going to be that 0.006%, right? So then we need to look a little bit more closely and say, okay, is specialization, does it actually lead to elite athletic performance, right? So what's the actual data for this beyond just injury risk and burnout, et cetera? What are some of the long-term health implications, and does it really worth the risk? So let's look at short-term athletic performance. So there's tons of data right now that says in the short term, if you're 11, 12, or 13 and you specialize in a sport, then you're gonna have increased injury risk. There's, 10 years ago there was any data, now there's we know that. If you play single sports, you're gonna be increased risk of injury. And then if you look at kind of like volume, right, which I talked about volume a little bit more, this is a study that was done by Nirav, who's down at Emory right now, and he looked at volume, and basically what he found was that if you played more hours per week than your age, in years, then you're 70% more likely to experience severe injury. So it's not only just specialization, it's volume, right? So if you have a 10-year-old, you should be averaging about 10 hours per week of sports. If you're 14 hours a week. And this is, organized sports, not necessarily kind of like free play and things like that. So that's a good marker in terms of volume. So if the kid comes in, they're playing multiple sports, but they're at 20 hours a week, don't be like, yay, you're playing multiple sports. You need to be decreasing that volume down as well too. So that's the second part of this that's really important. And then the other thing we look at is how does playing multiple sports actually impact athletic performance? So there are a lot of studies that were done in Europe that looked at gross motor coordination, your ability to kind of perform on different kind of motor tests, and they found that diversified sports training better fostered elite athletic potential. So it's, if you're able to participate in multiple sports, you're going to be a better athlete because it helps your motor skills in different ways. This was a study that was done in Europe where they looked at 735 boys who are kind of in that early, kind of late elementary school, early middle school age, and they found that those who played multiple sports were able to do better on kind of basic things that we used to do in PE class, broad jump, gross motor coordination, et cetera. So once again, you're seeing some of the kind of the more important things in terms of how it makes you a better athlete. And once again, this was in Germany where they looked at when athletes actually specialize, and then they found that those who specialized earlier into these elite training academies actually left their sports earlier. So all that kind of data is really there. And then, in terms of like looking at it from a more holistic standpoint, David Epstein, who's an author, looked at this and found that if you look at professional athletes, and we'll look at some of the more specific sport data, professional athletes for the most part actually played multiple sports for much longer. Okay. So once again, we need to tell this to parents because they don't necessarily concentrate on that. They think about the one athlete who kind of was at age 3, really started to concentrate on one sport. So if we look at NCAA Division I athletes, okay, they actually specialize a lot later than kids who actually dropped out of sport in high school. So if you look at NCAA team sports, most of them actually played multiple sports in high school. So there's this misconception amongst parents that you need to specialize. Now, this is where I think some of the good data comes in, is that how does sports specialization impact midterm athletic performance? So what does it mean if you specialize at age 11? What does that mean for you potentially as a professional athlete? And as I mentioned, some of these parents are willing to take the risk if they feel their kid's going to get professional sports. And we'll talk about some of the some of the data. So I always say it doesn't matter about the data. Like, you're going to get injured, right? You can't become a professional athlete if you're injured, if you're tearing your ACL at 11. But some parents, like I said, want to ignore that. So we've done some studies here, myself and Brian, looked at the effects of playing multiple high school sports on NBA players. So we basically looked at first round draft picks over a period of time in the in the NBA, and looked at their high school athletic kind of participation. And we found that those NBA draft picks who were multi-sport athletes participated in more games, had fewer injuries, had longer careers than those who participated in a single sport, right? So we're telling these parents that, look, if you actually play multiple sports, even as a professional athlete, your professional athlete career is going to be better, okay? And then we looked at this a little bit more closely and said, okay, well, let's look at how specialization impacts load management, which is a hot topic in the NBA, and athletic success. And what they actually found is that NBA players who played multiple sports in high school was actually able to run more in games. They had less injuries. They were able to actually, have more load in their NBA careers. So once again, it impacts what they were doing as youth, impacted their success as professional athletes. When you look at NFL Combine data, so turning to the NFL, you look at who's actually invited to the NFL Combine. 88% of NFL Combine, and this is kind of held up year after year, played multiple sports in high school, okay? So once again, you don't have to specialize. If you're going to be making it to the next level, most of these kids were playing multiple sports. When you look at the elite of the elite, we looked at NFL quarterbacks who are multi-sport high school athletes versus those who are single-sport athletes. Over half of NFL quarterbacks played multiple sports. And those who did play multiple sports actually had more MVPs, they made more Super Bowls, they played better. So once again, even if you look at the elite of the elite, those who played multiple sports were doing better than those who played single sports. And this even carries over into baseball as well, too. This was a study that was done out in Pennsylvania, and they found that there was a higher rate of serious injury during a baseball player's professional career for those who specialized versus those who didn't. So once again, we've got NFL data, we've got Major League Baseball data, we've got NBA data. All of them are saying is that if you play multiple sports, you're not only going to have a better professional career, but you're also less likely to get injured. So it's not just carrying over for the kid who's 12 and playing on the club soccer team, it's carrying over for professional athletes as well, too. So basically what we're trying to do is chip away at these parents' conception and these coaches' conception that you need to be able to do this to achieve success, to get a scholarship, et cetera. The data doesn't support that. So when you share these various studies, it starts to set that groundwork and that culture of, okay, maybe we should be changing the way that we're playing sports, from the outset. And this is even in things like track and field, individual sports, and aren't team-based sports, where you see kids who are specializing, they just don't have that same level of performance if they were doing multiple things at a younger age. So we did one study where we just looked at all the data. Okay, we looked at all the sports specialization data, whether it be individual sports, team sports, Olympic sports. And when we did the systematic review, we found that it didn't matter whether it was elite, professional, Olympic sports, et cetera, even though most of them were retrospective, that single sport specialization led to increased injury risk and decreased performance. So this is a paper I like to hand to parents, and so read this, okay? Because it basically says, this doesn't make sense. It's not going to lead you to have better performance. And then finally, we have to talk about what's the impact on long-term health, okay, as adults. So, we talked about one aspect of it is that high school students are increasingly less physically active, right? Because we talk about the super active elite group, but then there's that other group which, they're dropping out, right? So these kids who are playing clubs have dropped out, or if they don't play clubs or they can't afford it, then they're not doing PE class. So then we've got this whole other group of kids who just aren't active. And the number of PE notes I have to write for kids who don't want to participate in PE, not because they're injured, but because they run 5 minutes and they say, oh, I just don't feel good, it increases every day. Okay, so I think that's more a reflection of the fact that kids don't want to be active or aren't being basically, in an environment in which physical activity just in and of itself for benefit's sake is being promoted for these kids. And as a result, we're seeing more kids who are going to get diabetes, there's going to be more cardiovascular health issues, et cetera, et cetera. So these kids, we joke, by age 13 you're dropping out, but once again, it's what's going on later down the road that we have to worry about. And things like ACL injuries, meniscus injuries at age 12 or 13, a lot of now we're getting this 15, 20-year data because we're doing these in kids, and we're seeing that these kids by age 20 or 30 are having arthritis. So what does that mean from a healthcare cost standpoint? What does it mean from a health standpoint in terms of their physical activity level? We just don't want kids at age, by the time they're 30 or 40 to not be able to be physically active, which has problems down the road, okay? And finally, here in the last couple of minutes, as I kind of alluded to, what does this mean in terms of kids being able to, equally access sports? So we talk about, college scholarships, we talk about professional athletes, but what is it actually doing to kids who can't afford to play, right? And that's something that we don't talk about a lot, is the cost of this. So if you look at youth sports right now, it's a $37.5 billion industry, and it's kind of projected to be over $100 billion in the next 5 years, okay? And so it's going to continue to grow. This was the $70 billion number, which was a couple of years ago. In 2035, it's expected to be over $100 billion. And if you look at the average amount of money, 63% of parents will pay, somewhere between $100 to $500 a month, with a good percentage of them paying upwards of $12,000 a year. And you guys saw that scholarship number, that was $14,000 over 4 years. So once again, you imagine at age 8 or 9, you're starting to play travel ball, you're playing travel soccer. You take that over 10 years, a lot of parents are paying $120,000, $150,000 a year for their kids to get injured, okay? But then you see what's happening to that other group of kids who can't actually access sports. And nearly a third of kids who make under $25,000 a year can't participate in team sports. There aren't avenues out there, right? Your school doesn't have it. There aren't rec programs anymore. And there aren't equitable kind of programs. Yeah, they may have a scholarship or two for some kids, but the vast majority of kids can't access it. So as a result, they're left out of sports. And if you look at the demographic, you can see, individuals who are from lower socioeconomic groups just don't have access to that. And that disparity is increasing more and more and more as youth sports become more and more professionalized. And a lot of parents will say that they have difficulty paying for youth sports. It's just something they're trying to budget. They can't do it. You imagine you're making $50,000 and you have to pay $10,000 a year for sports. It just doesn't make sense for a lot of these parents. And as a result, their kids just can't participate in it. And so what a lot of parents feel, there's this misconception that scholarships, beyond just the parents are trying to, have their kids go professional, are going to individuals who actually need it. And if you actually look at where scholarships are actually going, it's actually going to individuals who have higher socioeconomic status, right? So how do you get a scholarship? You have to go to showcases. You have to play youth travel sports. You have to travel across the country for where coaches are. So the only people who can afford that are the people who have money to pay for it. And who gets scholarships? Usually groups who don't need it, okay? So once again, this is happening, particularly you look at it in NBA data, you look at it in some of the NFL data as well too, that a lot of people are getting scholarships come from higher socioeconomic backgrounds, which is leading to more and more disparities in terms of the way kids are playing sports. We did a study looking at AAU teams and where NBA players essentially played. And if you look at NBA players and where their AAU teams were located, they usually came from higher socioeconomic areas. So there's this misconception that, there's a kid, he's from a lower socioeconomic group, and he plays on this AAU team that's located in this area, and then he gets a scholarship and goes and play. If you look at the vast majority of these kids, they were living in an area of higher socioeconomic status. Their AAU team was an area, a very well-off area, and as a result, they had access to it. But if you live 2.5 hours away from an AAU team that basically is going to allow you to get professional, how are your parents going to get you there? Can they take time off of work? What's the travel time back and forth? What does it mean for you in terms of school? It just doesn't hold true. So we're seeing this trend in every sport, is that people who are going professionally are the ones who have money, and as a result, everyone else is left out of it. So basically, we know that youth sports has this culture of injuries, and access is much more complex. And that's really the other part of it as well too, is that kids aren't playing. And for those kids who may actually have that ability to basically, play in this complex, then when they get injured, that's the other part of it as well too. There are issues in terms of them basically getting in. So if they can afford it, there's issues on the back end in terms of healthcare. So we looked at kind of kids who are youth sports athletes, and if they tear their ACL, if they're lucky enough to kind of get and play these sports and they get an injury, there are a lot of disparities on the back end. So that's the other aspect of it as well too. We find that if you have public insurance and you're a youth athlete, it's going to take longer to get an MRI. It's going to take longer for you to get your ACL reconstruction done, and you're more likely to have meniscus injuries. So once again, think of it on the back end as well too, is that if you do even get a kid who is from a disadvantaged background to play in this youth sports culture, that when they get injured, there's a disparity there as well too. It's something to consider. Even from a language standpoint as well too, we basically did this study where we looked at patients who were English speaking versus Spanish speaking, and just basically called up offices and say, hey, I tore my ACL, my youth athlete. And you could see that the vast majority of people were basically based on insurance status or language, were not able to get an appointment, as opposed to if you're English speaking and you had private insurance. So the disparities are kind of built into our healthcare system, and it extends beyond just the youth sports level. And you see this in other areas as well too. You see it in terms of shoulder instability, where if you have public insurance, it's much harder to basically get in versus private insurance. You see this with meniscus tears as well too. So the big question is, this culture needs to change, right? Sports are great. Sports were really important for me growing up, but we need to create a culture change. So how do we do that? We need to constantly educate parents, coaches, and athletes about the risk of sports specialization. we need to invest in competitive recreational and community-based programs so kids can play, right? So you don't necessarily have to pay $5,000 to play for a club, but there's something in communities where kids can play and be competitive, right? Because a lot of these kids, they want to play. They don't want to necessarily play on the team that just is 30 minutes a day and you're kind of playing. They want to be in something competitive where they can push themselves, but they don't have access to it. So really investing in these recreational community-based programs. We need to really increase funding for school-based sports and coaching staffs. I think that's really important. If we kind of really emphasize high school sports again, I think that can change the culture and take it away from just sports being part of the club culture, and reducing disparities both in terms of participation and then the injuries that they see on the back end. I think as clinicians, if we can help to decrease those disparities that we see in terms of access and injuries, and I think that'll be really important in terms of getting kids healthy and keeping them active from a lifelong standpoint. And encourage free play. Take your kids to the park, invest in that basketball court, put that chain link net up in your neighborhood if you see it, because kids will be out there and playing. And instead of having just a play date with the kids on the soccer team, maybe just have a bunch of kids go to the park and throw around a football, do something else. I think that's really important for kids, both socially and emotionally as well, too. So thank you. That was a whole lot of data, but clearly something that there's a lot to be done and a lot of changes we can make. So thank you, and I'll open it up for questions. Thanks.
Is there any data on kids who work with private coaches as opposed to, say, their school or other people? Because I've had parents argue, it's like, oh, well, they'd be playing this much anyway. It's just now they're training with a professional coach instead of parent volunteer, et cetera.
Yeah, no, that's a great question. I think it's still the volume still holds, regardless of whether you're a private coach or you're doing it with, a more of a club-based entity, the injury risk is still there with that. I do think that and this is the hard part, right? It's who is a private coach? What's the training that they have as well, too? Because there's some private coaches out there, or trainers who are great. They look at core work, they look at mechanical work. They're doing all the things that are important, talking about nutrition, and that's great. But then you've got other, trainers who are just feeding into that as well too. It's they're even doing more hyper specialized stuff. So baseball is that one example, the pitching coach, right? It's I'm working with the pitching coach, and that pitching coach is really teaching me how to throw better. But then you're just doing 15 hours of that repetitive activity as well too. So I think a lot of it is both looking at the volume, but also looking at who is coaching and coaching that. So I think the one thing which I think has been good for some sports is strength and conditioning coaches. I think that's important because a lot of athletes are concentrating just on the skill development as opposed to that total body development. So I think when I do have parents come and say, look, we have money, we want to be able to work with someone, work with someone who is working on those things that aren't related to your sport. And I think that's really key because I think at least then you're getting athletes to think about it a little bit more globally. But then you have to take in the volume as well too. Yeah.
Hello. So I'm a pediatrician, and I'm also in charge of a bunch of adults who play tennis, and I arrange all their schedules, and I'm always recruiting people. And we have, unfortunately, we've gotten a whole bunch of really good players. Most of them are teachers, tennis teachers and stuff. But what I find is that kids who did tennis in high school and college just don't want to do it anymore. First of all, because they can't find anybody at that level. I learned tennis after college. And so you can only get to this level, but they're at such a high level they can't do it. So do you find that in other sports too, that kids burn out, the ones that don't make it professional, et cetera?
Yeah, no, absolutely. I think that you see it a lot. I think in a lot of the individual sports as well too. You see that. We see a lot of gymnasts, we see a lot of runners, et cetera, who burn out because it's that culture, right? It's playing at that high level. So I think, the individual sports are a whole nother talk you give as well too, because I think that's also harder. For gymnastics or tennis or things like that. Yeah, you can't progress unless you're doing it, at that kind of high level. But I do see that that a lot of kids are burning out because of that culture. Totally agree.
Thanks, Dr. Pandya. I love hearing your talks that you give about this issue. I was wondering if you have any insight into the dancer population. Yeah. I know it's a little bit more specialized and nuanced.
Yeah, that's actually a great question. So, I kind of lump the dancers in with the gymnasts as well too. The amount of dance that some athletes do, I had a girl come in, I think it was last week, it's 35, 40 hours a week of dance. It's pretty crazy. Like, and we concentrate a lot on soccer and kind of those kind of club-based sports, but we see tons of overuse in those athletes, and it's kind of repetitive activity, lower extremity stuff. So I think absolutely that the dancers is really hard, right? So the balance obviously is in order to get to that elite level for a lot of these dancers, they have to do that number of hours because it's kind of like gymnasts. But we see a lot of lower extremity injuries, a lot of stress fractures in that age group. So I think dance is definitely one of the major culprits of kind of those overuse specialization injuries. And it kind of gets forgotten a little bit because we don't think of it as the same way as as some of the team sports, but absolutely we see that same, if not higher injury risk, particularly in females because of that. Yeah.
Did you show them how to do it when they came in? Did you show them how to dance?
Yeah, that's a great way for them not to come back. Yeah.
Hi, I just had a question as far as like nutrition goes because we're dealing with people under the age of 14 and over. Do you have any advice on like what to tell people under that age when they're still developing versus like age of high school? Because I feel like a lot of my kids, before 14, they're not even thinking about nutrition. And so protein intake, all that kind of stuff. So I'm just curious on that.
Yeah, no, that's a great question. So I think, with that under 14, because more and more kids, especially we see this a lot in the boys now with social media, like they all want to get big and buff like me, that was a joke. In general, the under 14 age group, I usually tell them is like the most important thing to do is have a balanced diet. I think at that point, like, they're thinking about protein intake. They're talking about supplements, all these other things. Like concentrate on a balanced diet and concentrate on sleep, right? And concentrate on hydration. Those are the key things. It's like just drink water, have a balanced diet, and then when you get to that over 14-year-old age group, I think it is a good idea for a lot of these kids to see a nutritionist, right? And that's usually covered by insurance. I think it's really important because as parents, having a 15-year-old now, I can tell him everything I want, but when someone outside tells him this is what you need to eat, this is what the impacts are, I think that's really important. So I think we don't talk about nutrition, that's great, nutrition and sleep enough, because I think that has a much bigger impact in terms of how kids perform than the private coach you're working with, or like how many hours you're out there kicking a soccer ball. Like that's the stuff that's really modifiable, because a lot of these kids, as we all know, they're on their phone until 1 a.m., they sleep for 3 hours, they don't eat breakfast, they have Cheetos for lunch, and then they're like, why am I tired at my game? I'm like, well, because you're not eating, So I think it's good for them long-term to develop these habits, and I think it's an opportunity where I think kids are actually thinking about things a little bit more, so I think it's a great opportunity to educate them so that they can be good as adults in terms of making their choices. Yeah.
Hey, Nirav, thanks for your talk. When you're talking to a kid and you get a sense that they don't like the sport, that this is from the parents, how do you navigate that conversation?
Yeah, that's a tough one. I think a lot of times it's interesting. So I always get worried when I go in for the visit and the parents basically guiding the visit. It's like the kid hasn't even talked a lot. So a lot of times I'll actually, especially if they're over 14, 15, I'll have the parents step out and talk to them about it. And I'll ask them like, are you enjoying this? Is this fun? Most of the kids get it, like I think, I give these talks and kids are like, yeah, I get it. I don't enjoy sports. I understand I'm getting injured. So I think then when I get that feedback from them, I really tell the parents, I'm like, you need to ask your child if they're actually enjoying it. When was the last time you actually asked them? And they're like, I've never asked my kid if he's enjoying it. I just paid for this. And all my friends or all my parent friends are in that sports group. So I think you kind of have the kid, the parents actually ask them. And it'll be interesting to see how many kids will actually tell them that. So I think it's important for parents. They think they're doing this for their kids when they're actually doing it for themselves a lot of the time. So I think it's just shifting it because they just kind of get caught up in that rat race. So I think a lot of it is having them actually ask their kid. And a lot of times kids are coming in not because they actually have a structural injury, but because things hurt a lot. Like my knee hurts, my shoulder hurts. And that's a sign of them not enjoying sports. So I try to tell the parents that. I'm like, they all want an MRI. You get the MRI back. It's normal. And you're like, well, this is probably because their body are emotionally telling them that they're not enjoying what they're doing, and you need to think of something different. And for a lot of the parents, and you have that conversation, and then they're like, well, then how's my kid going to go to play college? And that's where that data comes in. That's where that comes in as well, too. So.
One last question. So are there any studies to help parents get these kids into adult exercise programs? Because there's a lot. What I find is if I wasn't playing tennis and if it wasn't that enjoyable, I probably wouldn't do any exercise.
Yeah.
You know what I mean?
Yeah, no, that's a great point. I think that is the next level, is like how do we transition kids? And I think there's an opportunity when kids from high school to college go off. How do you then make them independent in terms of athletics? Because I think when we had PE, when you had other things, you it's kind of silly, but you knew how to work out on your own. But you take these group of kids and they've been being told how to work out and like how to throw a basketball and then throw a baseball, and then suddenly you're in college, you're like, well, I'm not playing club sports anymore. How do I work out, right? I can't just go and throw a ball around anymore. So I think there's an opportunity, and this is where I think where the PE programs, et cetera, come in to kind of allow kids to transition to when they're independent, how to work out, without having to also pay $90 for Orange Theory or whatever. It's just like, go to the gym. This is what you do. This is how many days you work out. And that education about basic working out principles is lacking. So I think there definitely is a need for that.
Thank you for your talk. I was just curious, outside of your, professional work, kind of just, you mentioned changing the culture. Do you have like an example of like a quick like elevator talk that you do for parents in the community when you run into them, your kids' friends and stuff, of just like, hey, by the way, just trying to plant seeds in people's minds?
Yeah, I think the key thing is that when you talk a lot, the parents will always say, and Danny and I were talking about this, is like, our weekends are filled up with like, we're driving to Manteca for baseball, we're driving to Modesto for a soccer game, and we're just like, we're all like complaining about it, right? But we're like, our kids really like it, right? And I'm like, same sort of thing, like, do your kids actually like it? Like, could you be doing something else? Like, is your kid, are you worried about your kid getting injured? Like, I think it's just, what I like to do is just like have them question what they're doing, because we don't, right? Because we're afraid to question it because it's what's comfortable. So I usually tell these parents, I'm like, really think about, is this what you want to do? What could you be doing with your weekend differently? If your kid's been injured, like, do you think they could not have gotten injured? So I think it's just having people question and think about it a little bit more, which is important. And then I do kind of throw in the, most of our kids aren't going to play professional sports. They're not going to go to NCAA data. So I think I kind of throw that in there as well too. And then, I think I use the professional athlete data. I'm like, just look at your basketball game, watch the Warriors tonight and see how many of those people on the Warriors actually played multiple sports, right? 5 of them, okay? You guys have watched Pat Spencer. He was like a college lacrosse player, and now he's playing basketball. So I think it's just like having them open their eyes to their world outside of their kind of travel ball world as well, too. Yeah.
Nirav, on that point, just real quick, what are your thoughts? We obviously see, like in, let's say, travel baseball, you talked about the discrepancies with these rural areas where there's not as much care, there's not as much access, they don't make as much money, so they can't afford a lot of these things. But you do see a lot of these families that come from these rural areas, kind of middle of California, they throw all their money at this stuff so that their kids can go and do it, and then it's 100% in. How do we get the education to people in these situations that aren't injured yet, but still need that education to try to prevent that from happening?
Yeah, no, absolutely. I think a lot of it is some clubs are pretty good, and some of these associations have been good about kind of giving some of that education. So I think it's advocating, like for one thing with baseball, they have the pitching rules, right? So that was a great, step. But I think it's the clubs making it part of their, like whenever we join a club, there's forms to fill out, but maybe you watch a 15-minute video on, like the risk of specialization, or like if you kids play soccer, you've all watched the concussion video and things like that. So I think that's just should be part of when you sign up for these clubs. You have to watch that. As much as all of us want to go give talks every single club, it's harder, right? But I think it's making it part of the sign up process, and the coaches to get certified in as well too. Like part of this is there needs to be certification and understanding that these are some of the risks. So I agree. It's the worst is when you get a kid who's spent their $15,000 from Central California, they're playing soccer and they tear their ACL, and no one had told them that this is what could happen, and that impacts everything, right? The kid's not playing sports, the family can't afford it, and it's just this downstream effect.
I'll go to the app real quick. It's a good question. As a pediatrician, I'm seeing more anxiety in teens and it carries over into their sport, i.e. competition anxiety. What strategies are used to help refocus their anxious energy and energy that will work for them, not against them?
Yeah, so I think a lot of that, and I agree, I'm seeing that a lot as well too. I think a lot of it is, I know we don't want to like the phone being an issue, but social media, right? Because all you see is highlight culture, right? No one sees the kid who's having a regular game, or everyone is seeing like there's this assumption that you have to do this crazy, amazing thing on the field, and that's kind of like your value as an athlete. So a lot of kids get anxious because they're like, maybe I'm not that good, or I won't have that highlight, or everyone's going to see me, right? Because now games are curated, right? So if you have a bad game, someone's video it, it's going to be on social media. So there's a lot of anxiety about what's being seen out there. So I think for a lot of kids, I tell them, don't look at highlights. Like, don't worry about highlight culture. Like, stay away from the screen for that. And I think a lot of it is there's a lot of, especially with the competitiveness of it's important to be able to, do things like, see a sports psychologist, talk about these things, do, visualization, meditation, things like that. Because it is intense, right? Like the culture is their parents yelling at you on the sideline, their kids who are videotaping it. This is also this pressure of like, you're going to talk about it all weekend anyway, because that's what you're doing. All your parents are in groups. So I think there's a lot in there. And I think it's just trying to disconnect them both, literally from the phone as well as from that culture and, so, kind of socially as well too, which is really important. So I think it's just recognizing it and then trying to give them strategies to disconnect from it.
I'll go to another one on the app because it kind of ties in what you were talking about earlier with strength and conditioning. So, and I get this question a lot in PT when we see these kids that are trying to come back from kind of these more basic injuries. What's a reasonable age to begin weight training in kids, and is it safe to weight train as a kid?
Yeah, absolutely. I think, the traditional, like, if you lift weights, you're going to stunt your growth doesn't really hold true. But I think it's important to be able to, like, understand what's proper lifting technique, how much are you supposed to do it? You're lifting for sport versus lifting for bulk. I think a lot of people will lift because they want to have that Instagram body, especially with certain groups. I think that when you're in a younger age group, and this can start as even as, body weight exercises age 8, 9, or 10, totally fine. When you're in middle school doing more high repetition, low weight exercises, and then in high school, kind of started increasing it up. But I think it's important to be with someone who knows what they're doing and making sure you're emphasizing to these kids, you're doing this to get strong, not to look big. And I think that's the important thing. And then when athletes are like, I've been lifting all these weights, I haven't been gaining weight. I'm like, but you're getting stronger, right? And also doing weight work that's functional. I think that's important. So it's more about if you're playing a sport, what's the weight work you're doing that's going to help your individual sport and prevent you from getting injured, as opposed to doing it just so you can say you benched 500 pounds sort of thing.
Yeah, you really need to stop posting your oiled up bodybuilding pics on Instagram, man.
So I've got a question, just playing devil's advocate for a parent. I tell them, hey, 10 hours, you're 10 years old, that's enough. They're going to say, okay, 10 hours of practice because my child is in right field for 4 games on Saturday, 4 games on Sunday. And so they're actually only really getting 7 minutes of play. So that 10 hour, the age hour, like any extra details or information regarding that? Because they're going to say, oh yeah, well, he plays 10 minutes of basketball on the AAU team. So, he could practice 9 hours and 50 minutes.
Well, I get that a lot. Yeah. It's like, well, it's a 90-minute soccer game, but he only played 30 minutes. And then, the coach. So I think I tell them in general guidelines, I'm like, look, like if you're in general, try to keep within that area. I think with baseball, like it's more the pitchers, things like that. So yeah, there's definitely some leeway between that as well too, but I'm kind of just laying the crypt, like, just kind of look at how much you're doing, what the volume is. And if you're getting more excessive, then I think it's it. But I do agree that, there's definitely some leeway in that. And I'll get parents will be like, my kid played right field and he was out there for 4 hours, but he just stood there for 3. So, so I agree that there is, you can, kind of shift that a little bit based on that. Yeah.
Outfield gets important, man. Start hitting in the outfield. You need outfielders. All right. One in the app. How do you talk to parents or athletes about time off and rest recovery when that's not what they want to hear?
Yes. So I like the concept of like just take a month off. Like just like blows parents' minds. They get really upset. So I try to use the concept of active rest. Okay. So do something different, right? So if you've got, I always say for every 3 months, take a month of active rest off. So if you did 3 months of soccer, like spend a month, like swimming, do tennis, do just something that takes you out of that skill-based environment. So can your kid go in the backyard and kick a soccer ball around? That's fine, but not within an organized framework. So using that month of time off, and I kind of craft it as, this is a way to build up or work on those things that you didn't. So your kid wanted to get stronger, they wanted to work on their flexibility, they work on the core strength, take that month to work on that and stay away from skill-based development. So the 3-in-1 rule is usually what I use for a lot of kids.
Any other questions, guys? There was just a comment. I'll read it out loud because I agree. Thank you so much for addressing pediatric sports disparities. Super important for safety net providers / Medi-Cal. So good job. Awesome. Well, thank you, Dr. Pandya. Always a great talk. Guys, check out 6 to 8 Weeks, their podcast. And we'll take a little bit of a break. And then we have Dr. Ramirez for another awesome talk on women's sports.